So, good afternoon to everyone. I'm Johnny Balmeo, and I will be your clinical instructor for this subject, NCM 112, or also known as the care of the clients with problems in oxygenation, fluids, electrolytes, infectious, inflammatory, and immunologic response, cellular aberration, acute, and chronic. So, for today, we're going to have a little discussion about the use of the incentive spirometer. Okay, so we will have a discussion afterwards. We're going to tackle about the checklist and the principle. Then last will be the demonstration of the COC2, or also known as the teaching client to use incentive spirometer. So let's discuss what is an incentive spirometer. When you say incentive spirometer, this is actually a device that measures how deeply you can inhale or how you can breathe in. Okay, it helps you to take slow, deep breaths to expand and fill your lungs with air. Okay, this helps also to prevent lung problems such as pneumonia. Okay, what else? When you say incentive spirometer, it is made up of a breathing tube. Okay, I have here an incentive spirometer, this one. So we have here the breathing tube, this one. Okay, we have the air chamber, and also we have here the indicator. Okay, also we have here the mouthpiece at the end. Okay, the indicator is found inside of the device. Okay, as you can see, the balls. Okay, here makikita ninyo, you will be able to see here some numbers. Okay, later we will discuss that. Okay, so this is the incentive spirometer. Okay, but this one is the flow-oriented spirometer. We have two types kasi ng incentive spirometer. Later we will discuss those. Okay, so why do we need to use incentive spirometer? Bakit ba kailangan natin? Okay, or should I say, bakit kailangan ng pasyente or ng client natin to use an incentive spirometer? Well, the incentive spirometer is actually most commonly used sa mga post-op or after surgery. Doon yung makikita usually in order to ng doc sa mga client na ka-opera lang. Okay, what else? Those people who are at higher risk of airway or breathing problems, and what else? Sa mga smoker, okay, or kaya naman sa may mga lung disease. This may also be include those people who are not active or cannot move well, yung mga bedridden, yan. Pwede natin silang paggamitan ng incentive spirometer. Okay, the incentive spirometer is also known as the SMI, or the Sustained Maximal Inspiration Devices. As you can see in the picture, ito yung meron ako. Okay, we have here the flow-oriented spirometer. This is the tube, the airway tube. We have here the mouthpiece, the air chamber, then the indicators. Okay, as I have said, the incentive spirometer is also known as the SMI, or the Sustained Maximal Inspiration Devices. Okay, it measures yung paghinga mo, pahigop. Okay, how you breathe in or inhale. Okay, usually ginagamit ito to improve the pulmonary ventilation. What else? To counteract the effects of anesthesia or hypoventilation. Okay, during our online discussion, I already discussed this one sa mga naka-attendong online discussion natin. Okay, bakit? Kasi si anesthesia po, meron pong merong effect sa may lungs natin. Okay, if a patient undergoes an operation, tapos nagbigay ng anesthesia, especially JETA or general endotracheal anesthesia, may possibility na magkaroon ng problema dun sa may lungs. So, the use of SMIs or the incentive spirometer will help to counteract the effect of anesthesia in your lungs. What else? Loosen respiratory secretions, lalo na yung mga plema na namumuo dyan, it can loosen. Mas madaling matatanggal. What else? It facilitates respiratory gaseous exchange. Okay, the oxygen and carbon dioxide exchange. And last, expand the collapsed alveoli. Sa ganun, yung mga alveoli na lumiit, we can bring back yung normal niyang shape. Or should I say, normal niyang size. Okay, they are designed to mimic the natural sighing or yawning by encouraging our client to take slow, long, deep breaths. Okay, so I have told you kanina that we have two types of incentive spirometer. Okay, as you can see in the picture here, this is what I am using, the flow-oriented. And the other one is the volume-oriented. Okay, tingnan natin what's the main difference between the two. Okay, this one is the flow-oriented. It measures po. Okay, this one measures the flow. Okay, the flow pasok po sa may lungs. Okay, the flow-oriented spirometer consists of one or more clear plastic chambers. Yung iba, meron pong isang chambers lang dito. Yung iba naman dalawa. Pero pinaka-common makikita niyo, tatlo po yung air chambers. Okay, then they have the movable colored balls. Yung iba naman, this ang gamit. Okay, these balls or these are elevated kapag ang pasyente natin nagbe-breathe in. Okay, as you can see in the picture, ang unang tataas dito is the red, followed by yellow, last will be blue. Okay, later in our checklist, we will discuss that. Okay, the longer the inspiratory flow is maintained, habang mahaba yung paghigop ng pasyente, okay, the larger the volume. Okay, so the client is encouraged here to take slow, deep breaths. This type of spirometer does not measure the specific volume of air inhaled. Hindi po na ito na-measure yung volume, yung capacity ng lungs mo. Rather, ang mini-measure na ito is yung pumapasok lang na hangin. Yung flow po ang mini-measure niya. Okay? Unlike dito sa may volume-oriented natin, as you can see in the picture, we only have one chamber. Then we have the tube and then the mouthpiece. Here we have the indicator. Here naman, we have the disc. Okay? For the volume-oriented spirometer, this one measures the inhalation volume maintained by the client. Kung ang kaya ng pasyente natin is 2 liters, okay, yun ang kayang measure ng spirometer na to. Okay, nag-inhale siya, ang pumasok na hangin is 2 liters, yun yung kaya niyang i-measure. Kaya like dun sa may flow-oriented, yung hinihigop mo lang ang mini-measure niya. Okay, when the client inhales, okay, a piston-like plate, ito po yun, or the accordion plated cylinder will rise. Okay, tataas po yan. Okay, then it will leave some markings. Okay, so pagka huminga ang pasyente natin, ito pong cylinder na to, should I say the plate, tataas yan. Tapos kung ang kaya ng pasyente is 2,500, the indicator will be here lamang sa 2,500. Next, when should I contact my healthcare provider? Okay, kailan ko ba kukontakin ang aking healthcare provider? Kapag ka, okay, if you feel dizzy or lightheaded, hihilo na sa paggamit. What else? You have a wound that is painful every time you breathe deeply. Okay, kapag huminga ka malalim, tapos sumasakit yung sugat, or kaya naman, yung opera sa'yo, okay, you have to contact the healthcare provider. Okay, tanungin mo, pwede po bang i-stop ko muna ang incentive spirometer kasi masakit? Well, si healthcare provider ang magsasabi sa'yo niyan. Okay, we already discussed that during the online discussion. Okay, kung kailangan bang ihinto or hindi. Okay, also, when you have questions or concerns about how to use your incentive spirometer, kasi hindi lahat knows how to use an incentive spirometer. So, we as a nurses, you as a student nurses, it is actually your job. Okay, job natin ito para ituro sa client natin how to use this one. Okay, next. When should I seek immediate care? Kapag ka naman po, meron na pong pananakit ng dibdib, or kaya naman shortness of breath. What else? If you feel pain, sa tingin mo, hihimatayin ka na, well, that's the perfect time na kontakin mo ang iyong healthcare provider. Now, before we move on to the demonstration time, if you guys have some questions, you can put it in the comment section, or kaya naman, you can simply message or comment na lang pala, no? You can simply comment in the comment section, okay, after posting this video. So, let's move on to the demonstration time. Teaching our client to use incentive spirometer, our main goal here is the patient accurately demonstrate the procedure for using the spirometer. Tandaan na, to demonstrate the procedure. Hindi po makuha yung maximum na level. No. Hindi yun ang goal natin dito. Ang goal lang po natin is to make the patient demonstrate accurately the procedure, okay, on using the incentive spirometer. What are the equipments? Okay, we only need this one, the incentive spirometer. Pero kung ang case po natin is merong communicable or contagious disease ang pasyente natin, such as tuberculosis, definitely you have to use PPE. And don't forget the alcohol, of course, for hand washing. So first, review the chart for any health problems that could affect the patient's oxygenation status. Kapag may sakit ang pasyente natin, tignan po natin yun. Or kaya naman may sinabi si Doc na level lang. Kaya sabi ni Doc, yung level lang na kailangan natin for the incentive spirometer is only 2,500. Doon lang po tayo sa 2,500. Then, day by day, mababago yung goal na yan. Next, bring the necessary equipment to the bedside stand or the overbed table. What else? Perform hand hygiene and put on PPE only if indicated. So, kung di naman kinakailangan, do not use PPE. Kasi nga naman, it's kind of offending dun sa may side ng pasyente natin. Identify your patient. Number 4. There are different ways how you identify your patient. We already talked about that way back in your health assessment and fundamentals of nursing. Next, close the curtains around the bed and close the door to the room, if possible. Okay? Ngayon, kung ayaw ng pasyente, ipasara yung pintuan, may karapatan ng pasyente, huwag mo isara. Kaya baka naman nahihiya ang pasyente or gusto ng pasyente is, meron siya nakikitang tao na lumalakad, okay, siya masusunod. Wala tayong problema ron. Pero when it comes in the curtain, as much as possible, close natin for the privacy of our client. Then explain what you are going to do and why you are going to do it to the patient. Okay, huwag mo sabihin na, kailangan niyo pong huminga rito. No, do not say that to the patient. Explain mo muna bakit kailangan ng pasyente na gumamit ng incentive spirometer. Next, assist the patient in an upright or semi-fowler's position if possible. Bakit? For the lung expansion, para mas madali po ang paghinga ng pasyente natin. Ang hirap naman kasing huminga if the patient is in prone or supine position. Okay? Next, remove the dentures if they fit poorly. Okay, tanggalin natin yung dentures kasi magkakos ng aspiration kapag nalaglag. Then assess the patient's level of pain. Kapag ang pasyente natin is may masakit, we can ask the doctor for the administration of pain medications para maibigay natin prior in performing the procedure. Next, demonstrate how to steady the device with one hand. Okay, isang kamay lamang ang gagamitin, then the other one holds the mouthpiece. Tulad na to. Okay, hawak-hawak mo yung device, then the other one, hawak naman tong mouthpiece. Pero actually, mga incentive spirometer ngayon, kaya nang gamitin you can simply hold it with your one hand, katulad na to. Okay, meron na kasi ritong lagayan. Okay, you can simply, the client can simply hold it by one hand. Pero kung ang pasyente natin, they really cannot hold it by two or one hand, then tayo mismo ang humawak para sa kanila. Then assist the patient with the incentive spirometer. Next, instruct the patient to exhale normally. Then place lips securely around the mouthpiece. Then instruct our patient to inhale slowly and as deeply as possible through the mouthpiece without using a nose. Ngayon, kung ang pasyente natin gagamit po ng nose, okay, we can simply use a nose clip or kaya naman daliri na lang. Pinch natin to. Okay, hindi po pwedeng gumamit ng nose sa may pag-inhale. Kailangan bibig lang. Bakit? Okay, hindi pa may measure yun ng incentive spirometer. Okay, next. When the patient cannot inhale anymore, this one suits for the volume-oriented, okay? When the patient cannot inhale anymore, the patient should hold his or her breath and count to 3. Okay? Check the position of the gauge to determine the progress and level attained. And if the patient begins to cough, splint an abdominal or chest sensation. Ito po yung volume-oriented, as I've told you kanina. Okay? We will instruct our patient to inhale deeply. Okay? So, ang mangyayari dyan, itong piston na to tataas. Then, let's say for example, umabot yung piston ng 2,000 or should I say 3,000 to. Sa may 3,000, okay, hold niyo yung breath niya, hold for at least 2 to 3 seconds. Then bitaw. Okay? The indicator will measure it. Okay? Meaning to say, ang volume na pumasok sa may lungs ni patient is only 3,000. Okay? That is for the volume-oriented. Kay flow-oriented, ibang case yun. Okay, mamaya sabihin ko sa inyo. Next, instruct the patient to remove lips from the mouthpiece and exhale normally. Well, if the patient becomes lightheaded, medyo nahihilo po ang pasyente during the procedure, you can simply tell them to stop and take a few normal breaths before resuming incentive spirometry. Now, encourage our patient to perform incentive spirometry 5 to 10 times every 1 to 2 hours if possible. In some other books, they use 10 to 20 times every 1 to 2 hours. But for this case, I use, my reference here is Coshier, Fundamentals of Nursing. So sabi ni Coshier doon, 5 to 10 times every 1 to 2 hours will be enough. Sir, bakit po ganun every 1 to 2 hours? The use of incentive spirometer does not only measure the capacity of your lungs. It will also use as a form of exercise. Okay? It will exercise also your lungs. Okay? Hindi lamang po neto mini-measure yung volume ng, or should I say, the capacity of your lungs. Okay? Next, clean the mouthpiece with water and let it dry. Huwag kang gagamit ng alcohol kasi if you use an alcohol, may iwang lasa. Okay? Water will be enough. And ano rin naman kasi since once insensitive spirometer per patient, so by simply washing it with water will be enough kasi ikaw lang din naman ang gagamit eh. Okay, next. Remove the PPE if used, kung gumamit ka, let's say gloves or mask, remove it afterwards and then perform hand hygiene and then document. Document mo kung ilan na nakuha mo. Let's say for example, for this day, ang nakuha natin is only 2,000. Tapos, chart natin yun. Then tomorrow, baka ang makuha ni patient is 2,500. Then the next day, baka maging 3,000. Meaning to say, nagkakaroon ng development. Okay? Kinakaya ng pasyente, or should I say, nagkakaroon ng development. Okay? Mas lumalaki ang capacity ng lungs niya to accommodate more air. Okay? Now, that is the end of our discussion. Let me just tell you how to use the flow-oriented. Okay? If you're going to ask me, sir, meron po ba tayong return demonstration for this one? Yes, meron po tayong return demonstration. Okay, paano ba ginagamit to? So, I've told you kanina, instruct our client to hold it by one hand and then the other one, the mouthpiece, sa may kabilang kamay. Pero since most of the insensitive spirometer ngayon is kayang hawakan ng isang kamay, walang problema. Tulad po na to. Okay? Instruct our patient to inhale and exhale normally. Pag-exhale niya, then put the mouthpiece on the lips and then inhale. Okay, maximum. Okay, tingnan natin kung ano mangyayari dun sa mga indicator natin. Okay, tingnan natin yung balls kung ano mangyayari. Okay, I'm going to breathe in. As you can see, tumaas po. Okay? Tumaas, itong color white, sumunod, yung color green, and then the other one, color blue, huling tumaas. Okay? The white one measures 600 cc per seconds na pumapasok po na hangin. Okay? 600 cc per seconds. Okay? Meaning, yun yung kakayahan ng lungs mo to inhale. Okay? So, napagalaw ko naman po yung green, meaning to say, I have 900 cc per seconds. Then, angat ko din itong blue. Okay, that is 1,200 cc per seconds. Meaning to say, yun yung kakayahan ng lungs ko. What if ang patient po is white lang yung napataas? Well, yun lang ang kakayahan ng pasyente natin. Kaya instruct natin ang pasyente natin to use the insensitive spirometer every hour. Nang sa ganon, maybe by tomorrow, magbago na po yun. Meaning to say, there is really a development. Kung ngayon, ang kakayahan lang ng pasyente is paggalawin yung white, walang problema, document natin. Okay, tignan natin, maybe by tomorrow, baka magbago. Okay, hanggang sa makuha niya yung blue. Okay, that's how you use the insensitive spirometer. Okay, medyo mahal nga lang kasi yung volume-oriented. So, ang meron lang tayo ngayon dito is the flow-oriented. If you wish to buy, pumili na lang kayo online. Mas makakatipid kayo. Okay? So, if you guys have some questions, just put it in the comment section para masagot po natin. Or you can simply ask your classmates na umattend ng online discussion because in our online discussions, merong batuhan ng question doon na nangyari. Okay, I guess that concludes our discussion. Maraming salamat guys and see you next time. God bless!